Welcome. Welcome to the 5th group of young researchers at Dokkhuset. Tonight we have 5 guests who will give us different perspectives on the challenge how to make digital services sustainable. Digital tools are increasingly being introduced as important means of communication within companies and the public services, and not least between providers of the services to the public. Most citizens are in contact with such digital services throughout their lives. The goal for tonight's project, SustainDiT, is to create functional and sustainable solutions. How is the experience by different user groups with, for example, the health and the welfare system and the social system in Norway? Does the technology with algorithms and sensors work as intended? How is the sensitive information and the privacy secured? The researchers you will meet tonight are investigating how digital solutions can be developed in the best possible manner for all users. But first, I will introduce to you Rannveig Tellemann Storeng, who will put the sustainability research in NTNU into a broader context. She is Director of Division for Research, Innovation and External Relations at NTNU. Please, Rannveig.
Thank you, Randi Wenche, and thank you to both you and Stig Larseter for the hard work that you have invested in giving us all this wonderful opportunity to learn more about sustainable digital transformations. Welcome to this evening where young and aspiring researchers will share their knowledge and research on topics that are of great importance to all of us and our global community. We are also so fortunate to hear from a couple of slightly more experienced scientists, but undoubtedly young in spirit. The consequences of climate change are no longer a distant threat. We are experiencing the severe consequences daily. At NTNU, many researchers from various departments and disciplines are working hard to find sustainable solutions. We have established a strategic research initiative called SusRes, where 47 young researchers work in 11 interdisciplinary projects. These projects all address transformative changes needed to achieve a sustainable society. We are very proud of our young researchers at NTNU, and tonight you will meet some of them. It is a great pleasure and honor for me to welcome you to this evening, where you will hear from our passionate and talented scientists as they present important results from their sustainability projects.
Thank you very much, Rannveig. As you understand, this is a huge strategic program at NTNU, which will endure for many years to come. So we will meet 5 researchers from one of these 11 projects, and they work with digitalization. There will be an intermission of 10 minutes, and after that, Q&A. Babak Farshchian will give us an overview over the digital landscape. He researches digitalization in service organizations within healthcare and social and welfare services. He leads the SustainDiT project and is active within information systems and computer-supported cooperative work. He mainly uses interpretive qualitative methods. Babak is an associate professor in software development and digitalization at the Department of Computer Science at NTNU. Please, Babak.
Thank you for so many nice words. And I can guarantee that I am not the youngest one who will be on the stage today. Welcome. Thank you very much for joining us. It's an honor to be here and to present our project to you. Our project is called Sustainable Digital Transformation, SustainDiT. And I want to spend a couple of minutes to discuss with you what we mean by this concept. And I want to use an example to illustrate what we mean by transformation, and that is online shopping. And I want to know how many of you have done online shopping, gone to a website and bought something. Yes, almost all of us. Yes, and online shopping is an example of a transformation because it changed the scene of shopping completely. Before we used to go to a shop, we used to meet somebody and we used to wear the clothes or touch the things we wanted to buy, and then we will pay and come back home. And now we do all this on a website. And this is a transformation because it changes a lot of things in our society. It changes the way we drive, the way we use our roads, the way we use our transportation. And this is what we call a transformation of society that is also enabled by digital technologies, like a website where you go and buy what you want. And there's also the aspect of sustainability in it, because if you think of online shopping, it is not only changing the environmental aspects. Of course, it changes the way we drive, it changes the way the amount of things we buy, because it becomes so much easier to buy stuff. But it also changes the social aspects, like we don't meet anymore the people who sell stuff. We get a lot of distances between people. And the economy also changed. For instance, we don't have the middle people who would maybe have a shop, sell the stuff, so we buy directly from big platforms like Amazon and what is the other one? Temu is the big one. Yes. So this is, as you see, is a picture of sustainability, and this also, just a simple example of online shopping, shows also how complicated it can be, and everything is connected to each other. But our project has a much more focus on the social aspects of sustainability, as you will also see from the presentations. And what somehow worries us, and what is the reason why we started this project, is that the rules for digital transformation are decided a lot by commercial actors. Most of them outside our country, most of them outside many countries. The big tech that all of us know, like Amazon, Google, who else? Apple. And these are companies that have what we call the market value as their guiding kind of principle. So the idea is to earn as much money as you can, which is also the idea of market liberalism, etc. But what we also see is that what is missing in research and also in the rules of how we can govern this digital transformation is where we have the public services. Where with the public service we assume a service that is for the public good, the service that creates public value for the society. And what we are doing in the project is to see how we can balance this difference between what we call the market value and the public value. And this is also in all of the projects that we have within our Sustain project. And we also have a focus on a set of technologies, because we want to get real, we want to do empirical research, so we need to know what these technologies are, we need to test them. And these are the three technologies that we are focusing on. Sensors are where you collect data. So when we talk about big amounts of data, these are data that come from sensors of different types. Algorithms are code or programs that operate on this data and make decisions, make decisions. And platforms are mainly, you can think of it as a website, like Amazon.com is a platform for shopping. I'll give you an example. If I have a user at Facebook, or even if I don't have a user in Facebook, Facebook knows a lot about me. And this is because Facebook has a lot of sensors around in the society, both in different websites, but also in the different gadgets, like in the mobile phones, etc. So whatever I do, Facebook will get data through these sensors about me. And Facebook will use that data to create services for me as a user that is interesting for me, be it shopping or political news, etc. It will use that data about me to give me information about to give me customized services with the information that I need, or maybe I don't need. And Facebook is also a platform, because it has this website that can serve billions of users. It creates a kind of front end to all this technology that is very difficult to penetrate and very difficult to know what is happening on the other side. Only Facebook knows about it. We can also look at another service that is a public service. But it uses exactly the same principles. So if you have delivered your taxes through SustainDiT, you know that there's a website, and SustainDiT actually has a lot of sensors. SustainDiT knows what you earn, knows where you earn it, when you earn it, and they collect all this data about you, and they give you, through their algorithms, like they give you the tax papers that are tailored for you and the way you have worked. And there's also the platform that is where you go to approve your tax. So these two examples mainly show that these technologies that are enabling digital transformation are the same, but the values they operate under can be very different. Some of them can be very commercial values, like Facebook. Some of them can be more public values, like SustainDiT. And what we are looking at in our project that is important to show here is that we are looking at the long-term effect of these technologies. So if you think of sensors, in the first site, they are very useful because a lot of data gives you very nice seamless services. So wherever you go, you can get the service that you need. In the long run, however, they will create more surveillance. So Facebook will know everything about you, and in the longer run, the trust we have in each other, the trust we have in companies, the trust we have in the society will be suffering because of this surveillance. And the same logic you can use for algorithms. They are very nice when they operate. They are in front of you. They give you more efficient services, but they also amplify biases that is shown by research. Like if you have algorithms based on data about employment in a company, where the history has been employing more men than women, then the algorithms that are based on this data will also recommend you to employ more men than women. So they will amplify the biases that exist in the society, and they will in this way reinforce the inequalities. Platforms are much more complicated and much more bigger. So platforms create this efficiency. So when you go to Facebook.com can actually operate the same service for billions of users, which is very impressive. But at the same time, it also reduces what we call the social capital, which means that it creates a wall between the users and the company, so you cannot see what Facebook is doing. There is no transparency in the way it is done. And what we also see is that the world is being divided into a few number of these very big platforms that are getting really proportional power in their hands. So these are mainly the problems that are in the core of sustainable digital transformation. What we do in our project, again, more focusing on what we will present to you here, is that we will be focusing on public services. So these are services from social, from healthcare, And that is what our PhD students in the projects are doing. But we also have a critical perspective where we ask difficult questions. Why is this service made like this? Because it has a long-term effect that is not desirable, for instance. And we also have innovation as a goal. So we know that digitalization is here to stay. We are not going against digitalization, but we are looking at different ways of doing this digitalization that is more sustainable in the long run. And as I mentioned, we also have a lot of focus on social sustainability, as you will see by the presentations that come right after me. And many of the presenters are also much younger than me, except Steinar. I think he is older than me, actually. Thank you.
Thank you, Babak. We proceed to meet Michaela Schmidt. She researched on how digitalization changes the way citizens interact with public organizations. For example, NAV and the tax agency. This digitalization trend affects both citizens and public employees' perception of their own organization. It is also affects the interaction and communication between these actors. She studies these effects through interviews and observations to understand how technologies should be designed and implemented to reduce negative, often unintended effects. Michaela is a PhD at the Department of Computer Science at NTNU. Please, stage is yours.
Where's my presentation? Yes, now we're ready. Thank you, Randi, for the introduction. So today I'm going to talk about sustainable digital services in the public sector and what it has to do with trust and relationship building. Now, imagine Peter. He's a very normal citizen. He has a 5-year-old daughter and he helps his elderly mother to manage her everyday life. Drives her to the doctor or goes shopping with her, things like that. But now he suddenly lost his job. And he's a little bit overwhelmed with the whole situation. He's not quite sure how to go about it, what benefits he can apply for, and what support he can get from government institutions. He really hopes that he can talk to someone who knows the system, who will listen to his problems, understands his concerns, and guides him through this bureaucratic jungle, just like a good friend would do it. Unfortunately, Peter lives in the age of digitalization. So that means that he's expected to find information himself on the internet and maybe send in online applications, but not get in contact with anyone. So he might feel a little bit left alone with his problem and starts to think that he can't count on his friend like he thought he could. So my research is concerned with specifically this digitalized interaction between the citizens and the government organizations, and how the technologies we use there are affecting the relationship between the two. But why is that even important? And what does it have to do with sustainability? Now, sustainability is not just about the environment or economics, it's also about our societies. And for any sustainable development, we need strong societies that can trust in their governments. And one way to build that trust is through the interactions that we citizens have with the institutions. And communication is one of the most important aspects of that interaction. Let's take a look at Norway, where NAV is the biggest provider of social services. They cover everything: child benefits, sick leave, unemployment benefits, and pensions. So basically everyone living in Norway will have to interact with NAV at some point in their life. And NAV has highly digitalized their services. So through their website, you can find a lot of information and you can apply for a lot of the services online. And we know that most people will access their website at first to find their information and apply for services. But we also know that a lot of them will additionally call or use the chat function or even go to the office to get more final answers or get assistance with whatever they're trying to apply for. In the end, only about 5% of all contact with NAV is face-to-face. Everything else goes to the web page, telephone, chat, email, social media. And it's especially people like Peter who are in very stressed situations, who might need financial assistance or support, who have a fundamental desire to meet someone face-to-face and talk to them. This is nicely illustrated by this quote. "I'm old enough to think that it's nice to meet a human being. I understand that human contact is going to be reduced, but I am convinced that it is extremely important. You can see the facial expressions, the body language. It's much safer and richer. It's definitely important to maintain human contact." So all of this shows us that it's not that easy to just replace the contact we have with the administrations through technology. And it often feels that there's a wall between us citizens and the administration, right? It's not that easy to reach a human on the other side. But how can we reduce that wall? Can we just tear it down? The answer is no, because those on the other side, they're humans, they have limited capacities, and a lot of the technologies we implemented, like automation and self-services, actually help them to better maintain their workloads. But they do experience frustration as well. They might find that it's hard to see the human on the other side because everything's just data. So you start to see this is a bit complex. We have people on both sides of a wall, and we don't quite know how to improve the experience for them, because the technology that's beneficial for one side might create challenges for the other one. So I want to understand these challenges and how we can overcome them through interviews and observations with both sides, the citizens and the employees. I want to know what their needs and experiences are, how they use the technologies, and how they think it could work better. And with that in-depth understanding, we will hopefully be able to reduce the wall by removing the stones that make sense to be removed. And with that, both sides can see each other again and build stronger relationships and trust. Thank you.
Thank you, Michaela. Next is Mariam Hagsenas. She takes a closer look at collaboration between the healthcare system and the social security services NAV in Norway. Which role do digital technologies play in this setting for both service providers and the users? How can these relationships be developed to improve the quality of services to the population and make them more sustainable? Mariam is doing her PhD in health sciences at the Department of Public Health and Nursing at NTNU. Please, Mariam.
Okay. Okay. Thank you, Randy, for the introduction, and thank you, everybody, for being here tonight. Now I'm gonna talk a little bit about collaboration between Social Security Service and Healthcare Service. We just heard that we have NAV in Norway, as a lot of you guys are familiar with, and as Michaela just mentioned, a lot of us would be in need of some sort of services from NAV during our lives. And for a lot of those services, NAV requires health information. Well, the obvious choice or solution would be that they collaborate. But are things always as straightforward as they appear? Spoiler alert, no. You might have probably heard about the crisis that Norway has been dealing with recently, with a low number of general practitioners. And on top of that, there is also expected shortage of other healthcare personnel for Norway. And to make it even more challenging, the reports has shown that not all the information that NAV receives are efficient, adequate, or even received in a timely manner. So, let us see how it is to be at the receiving end of this process. Here we have Kate, our patient, who has chronic pain, has been on sick leave for so long, and is trying to start thinking about getting back to work. But because of her situation, she has to go through a lot of, she needs services from different parts of healthcare. Has a lot of appointments with her GP, general practitioner, different appointments at different parts of the hospital, and all of that would end up in having a report of her medical situation. So circling back to the collaboration, so this updated information should somehow get to NAV. One way of doing that would be that the hospital writes a report for NAV for the general practitioner, and then the general practitioner would write an updated report about Kate's situation and send it to NAV. Another way of doing that would be Kate would gather all of those informations and updates and provide it for workers at NAV herself, which a lot of information might get lost in the process. So either way, we might end up with a frustrated patient who has been waiting for so long, has a lot of questions and concerns that has not been answered yet. So what I'm doing in my PhD is to see how we can make this process of collaboration more efficient and sustainable for both service providers, but also for patients like Kate. How can we reduce the workload on the service providers? How can we manage the extra responsibility that the patients might end up taking in this process? One solution would be to gather everybody together so they can meet and discuss. And this is actually what we did. Through a pilot project, we organized meetings where representatives from NAV, general practitioners, specialist healthcare providers, and also patients could join and discuss any issues that concerned NAV. And to make it even more accessible so that more people could join, we organized them digitally. So first, to get an overview of how the meetings were organized or carried out at the hospital, I observed a couple of those meetings and then interviewed people who participated in those meetings to see how they experienced this new way of working. What we found out was that generally people were satisfied with this new way of working. As one of the healthcare personnel mentioned that bringing NAV into this meeting was very successful. In a way, it saved the patient because she was really close to the bottom. A lot of the participants also talked about how they used this meeting and this new opportunity to increase their knowledge about each other and get to know each other a little bit more. Like issues like how NAV works, what are the processes when you apply for a service or benefit at NAV, or even what does a diagnosis mean in patients' everyday life. As one of the healthcare personnel said that it is about explaining this to NAV. The fact that the pain is very real, even if it's not always biomedically explainable, because it can be difficult to understand. But an even more interesting finding was that even though some people would join the meeting with some sort of negative perception about NAV and might experience that NAV is like a wall you cannot get through sometimes, the proximity and the opportunity of discussing and talking to each other during the meetings helped people to start building trust towards each other and specifically towards NAV and work on the relationship they had. As one of the patients experienced that I have wondered for a long time if NAV believes me or not, that they think I'm just making it up. That's how I feel, that I haven't been taken seriously. But after the meeting, now they understand and I'm being taken seriously. So this is the situation we started with before the meetings. And although we saw from the quotes that I just showed you that the meetings brought NAV a little bit closer in the process, but it also brought up some new challenges that came up from this collaboration. Issues like distribution of responsibilities. Who has which responsibility in this process? Where does the patient stand in this complexity? Or even an even more important one, data sharing between healthcare and NAV. What are we allowed to share with NAV? When should we share things with NAV and how to do it? And these are the topics that I will look further into in my project, and also to see how digitalization can contribute to solving these new challenges, so that hopefully the results of my project could contribute to having more integrated services, so that we can, at the end, help patients like Kate. Thank you so much.
Hello, then we will proceed. Steinar Krokstad is a supervisor in the project SustainDiT. He works with large amounts of health data in one of the world's largest databases, HUNT, in Norway. He will tell us about digitalization of research in HUNT project and how this is used for the good of society, research and health services for populations. How can we be sure that the information about our health is stored and used in a safe and responsible way? Steinar is professor of the social medicine at the HUNT Research Center and led the implementation of HUNT number 4 during 2017 to 2019. Steinar, please, stage is yours.
Thank you, Randi. As a young up-and-coming researcher, I was asked to have a talk about the HUNT study and the digital platforms we have established in this large study, and thoughts about how we can be inspired of these solutions. HUNT is a public health survey, and this is the HUNT Research Center at Levanger, who runs this study. And what we do, we collect large amounts of data from the population with interviews, questionnaires, clinical measurements. This is body composition, height, weight, blood pressure, a lot of clinical measurements we do, and we collect a lot of biological materials from blood, urine, stools, saliva, and you name it, we got it. These are stored in millions of small tubes in automated freezers. So we have a lot of these samples that we can store for a long time and use in research. And not at least when we analyze these biological materials, we create a lot of data, really big data. So we have to also develop solutions to store securely all these data. And as you probably know, who is here tonight, this is about confidentiality, integrity, and accessibility, the three topics that's at the core of what we do. It's the data have to be secured. The data have to have integrity, and we have a lot of redundancy in our systems, and it has to be accessible. It's not any big point to have data if researchers cannot access it. So I think the accessibility is our main success. Our success is based on how many researchers use our data over time. So now we have actually passed 250 PhDs based on this data. It's published around a mean of 2 international papers every week from the HUNT study. It's a lot of research going on based on our data. And our digitalization strategy is about find ways of storing and managing data worth trust, so the population can trust us. It has been on the core of our strategy since the 1980s. And 20 years ago, we established the HUNT Data Bank. And 10 years ago, we established the HUNT Cloud, which give researchers from Norway and other countries opportunity to log in and use our data in a very secure way. And in a way we have control over. It's our platform. And we are also working over years with building a culture of security and also in continuous improving following the ISO standards. So now the guys in HUNT Cloud is collaborating to build networks and share security and privacy knowledge in Norway and Europe, among other things, to be well prepared for the EU's new regulation, European Health Data Space, in a few years. So this is a picture of the web page for the HUNT Data Bank, where researchers can look at our surveys, they can look at our data and our variables accessible. So they can also order data from these systems. So when the studies are approved by the ethical committee, it is quite easy to access the data and find what we have in the bank. So this has been a great success, and this is a development from scratch. We have been continuously developing this solution that fits our needs. So that's not at least Jon Heggeland from your department, Babak, has worked continuously with the development of this solution for many years, and we are very pleased with the results. And for 10 years since we established HUNT Cloud here in Trondheim, and this is how the guys in HUNT Cloud like to present. They want the researchers to dive into this cloud and in their data lab, and where they have the resources they have and tools to do the research in a very secure environment. So we think we have succeeded in establishing these platforms that are very useful for researchers, and it's used a lot. So our data stems from the population in Nord-Trøndelag and Sør-Trøndelag. We started the HUNT study in the 1980s, inviting the total adult population of this county at that time, and the amazing result was that 90% of the total population met to this survey, and that's world record, I think, because it was also a tuberculosis screening, so people were really interested in in participating. So that was a good idea, and which have been followed up with new surveys every 10 years approximately. And in the last survey, we also had a survey in SustainDiT with a questionnaire. But these are surveys in SustainDiT with blood samples and clinical measurements and really deep data collection. And with these data, we can actually follow the health development of the population, a sort of health barometer of the population's health. And I show you now 3 of the most amazing changes we have seen in the population, these 4 decades. And the first is, as you may understand, the development of BMI in the population. And to be nice with the women in the audience, I show the data for men. 8% of the total population in this county had obesity in 1984, and the development is like this. And in the last survey, it's about 23% of the total population of men, adult men, in the have a BMI above 30. So that's a very clear but negative trend in population health. But we have also very positive trends, and the astonishing with these data because is the blood pressure that has lowered considerably. This is data from the first hunt 1 in the 80s. And you see blood pressure by age and by BMI. So BMI, higher blood pressure, higher age, higher blood pressure. And a lot of people with really high blood pressure. And it was actually very small changes 10 years later, but in the third survey in 2006, the blood pressure has actually sunk considerably in the population, and even more in the last survey. So this is very positive and nice trend associated with the better health of the heart and the vessels in the population. The third really amazing and negative trend is the development of the mental health for young people the last decade. This is from the Young Hunt study, female and males 13 to 19 years, and this increased level of anxiety and depression and mental health stress among young people, not at least girls, also for boys, but most for girls, that you probably heard and discussed in society in the latest years. And this idea with having a kind of barometer of the development, we have discussed in the Sustainable Digital Transformation Project. And the idea is it possible to create or establish a sustainable digital transformations barometer? And you have heard about all these aspects of digitalization that could maybe be captured in this barometer. And it's several dimensions, as you have experienced here tonight. For example, scope, innovation, economy, user experiences, discrimination, power relations, maybe also social capital and health aspects around these transformations. So maybe we could make several dimensions that we can follow and to actually monitor the digital transformation in society and have discussions of that of direction we have. So this is an idea we are struggling with, but and I think it's quite complicated. So maybe we have to ask the audience, how can we make this happen? So that's an idea based on the Hunt study and to create a barometer. So that's all from me now. So now we are going to discuss these topics. Thank you.